Today we'll be talking about peer support groups as a self-care strategy. All right, peer support. This is the process of giving and receiving encouragement and assistance to achieve long-term recovery. It's a place to offer emotional support, share knowledge, teach skills, and connect with others. This is a space where individuals can share their stories, experiences, struggles, and victories. There are informal peer support groups and are usually known as self-help. These are also very effective. Peer support groups are more formal, and they may be attended in person or as an online support group. These are cyclical and typically meet weekly, bi-weekly, or monthly. Peer support is an evidence-based practice that is not only used for self-care, but many other things. Meeting with others who have similar experiences shows anyone that they are not alone. So what do they look like? A formal peer support group will have a facilitator who will keep the meeting on track. They'll warn others when possible traumatic stories or subjects are shared, and this is known as professional facilitated. The facilitator is a professional who usually does not share their own experiences with the group. They are a mental health professional, social worker, psychologist, religious official, or they can also be trained as an expert facilitator. The format. Curriculum-based, these are educational, and they include specific information and tools for managing related issues. The facilitator presents and encourages health and collaboration through information. The topics are typically predetermined, and the facilitator may distribute learning materials. Topic-focused. These discussions are focused on one topic area and are less structured than curriculum. The topics can be rotated, and members share their own personal experiences that are related to the topic. Open forum. These usually do not have an agenda, and they're not structured. Discussions will progress based on what members share. In general, people experience a camaraderie knowing that everyone in the group is experiencing troubles with the issue at hand. It's a non-judgmental atmosphere. Participants can express their own feelings with others that can relate. And keeping these groups diverse also ensures that experiences from all backgrounds are represented. The facilitator should help ensure that the group fosters an atmosphere that is inclusive of all members and highlights commonalities more than differences. The facilitator should be self-aware, well-versed in emotion regulation, and should always practice effective listening. Depending on the group, they should also be able to spot disruptions and emotionally charged subjects, and use techniques to help group members explore these subjects without interruptions. Benefits. There are many specific peer support groups already established. Most are available online if there are no in-person groups in your area. Additionally, most online groups can make members feel more anonymous and allow them to feel more open than in an informal group with their peers or an in-person group with their peers. They may not know anyone in the online groups. They can help people realize that they're not alone in their struggles. Listening to peers allows you to gain hope and learn helpful information or techniques. You can express your feelings using evidence-based practice while also helping others in the group. Just as you gain helpful information and techniques from them, they can learn it from you. And they're very cost-effective. Many are free or very low cost. They can prevent inpatient hospital stays. And they're generally less expensive than one-on-one therapy. So where did they come from? Well, in the late 18th century in France, Jean-Baptiste Poussin began employing recovered patients at the Bicentre Medical Hospital. He found that these staff were more gentle, honest, and humane. This helped mark the shift into the moral treatment area of mental health care, and this was not an isolated practice. Now, peer support surfaced again in 1965 when Robert Karkoff and Charles Troe advocated for peer integration into hospital settings. Again, in 1967, Emory Cohen proposed community mental health care, which required peers in mental health treatment. And in 1970, the self-help movement helped ensure that peer support groups were here to stay. There are many specialized support groups, and these include Recovery International, the Alzheimer's Association, Anxiety and Depression Association of America, and the Anxiety and Depression Association of America Peer-to-Peer Support Group, Caregiver Action Network, Federation of Families for Children's Mental Health, and Parent Support and Advocacy Network. And there are so many more. Does it work? RI International found that offering peer support to their patients caused a 56% reduction in hospital readmission rates. And in 2010, the National Institute for Mental Health found that individuals who participated in peer support groups had an overall increase in social functioning, a reduction in readmissions to inpatient hospital stays, and they experienced a more positive regard towards mental health treatments in general. Peer support groups are considered evidence-based practice, and they're recommended by clinical and medical professions all over the world. Professionals recommend peer support groups for difficult medical diagnosis, domestic violence, addiction, self-care for practitioners of all kinds, and they're even required by law for some who have committed violent or drug-related crimes. The pop culture of the 1970s helped bring peer support groups to the forefront of self-help culture, and they're still seen as a vital tool. In fact, many workplaces are promoting peer support groups to their employees who may be experiencing depression, anxiety, or a difficult mental health diagnosis. There are some limitations and resistance, just like any other self-help strategy. Peer support is generally accepted by most because it can feel less formal than one-on-one counseling, but it can be met by resistance in the same way as seeking regular mental health care. Many may say, just put on your big girl or boy pants, or I don't want to air my dirty laundry to strangers. And in more severe cases, peer support groups may not be enough, and they should be used along with more clinical care, including medication. And many individuals from marginalized groups may not feel represented if they're the sole individual in the group that does not identify with the dominant demographic. And we're going to do a demonstration today. This is going to be for an online support group that is curriculum based. Hello everyone, and welcome to our anxiety support group. I'm Serena and I'm your facilitator for today. Last week we spoke about our topic today, and this is the box breathing method. It's also known as the square breathing method. Now this is very similar to some grounding techniques that we've covered in the past. Here's the handout. I'll distribute it to you all. Now, just like the grounding technique, box breathing can help prevent the onset of a panic attack or help bring you down from an attack once it's started. Now, to ensure that you can be successful, we'll be practicing this today. And I've found that practicing this when you're not in a panic state is key. So you're used to it and comfortable once you are panicking. And once you've practiced this, you're more likely to use it when you need it. Okay, this is also known as square breathing, and it's a technique used when taking slow, deep breaths. This can help heighten performance and concentration and is a powerful stress reliever. I mean, it's beneficial to anyone, especially those who want to meditate, and it's even used by athletes, police officers, and Navy SEALs. For those of you who may have a lung disease or any obstructive lung issues, you can take it a little slower. You can breathe for 3 seconds versus 4, whatever works for you. So today I'll be counting for you, but after our meeting today, I would like each of you to commit to trying this at least once, and you can count out loud if you find it more therapeutic. So just close your eyes and listen to my voice. Step 1, you're going to breathe in while I count to 4 slowly. You're going to feel the air enter your lungs. Step 2, you're going to hold the breath for 4 seconds, and I'll count this for you. And try to avoid inhaling or exhaling for the whole 4 seconds, or 3 if needed, if you have any trouble. And then you'll slowly exhale through your mouth for 4 seconds. And you'll repeat these steps until you feel really recentered. One of the main reasons why I find this so helpful is it's just so simple. Okay, is everybody ready? All right, let's begin. Okay, begin breathing. 1, 2, 3, 4. Now hold the breath. 1, 2, 3, 4. Let's slowly exhale. 1, 2, 3, 4. Let's breathe in again. 2, 3, 4. Let's hold. 2, 3, 4. Let's exhale. 2, 3, 4. Let's inhale. 2, 3, 4. Let's exhale. 2, 3, 4. Let's hold. 2, 3, 4. Thank you. You all did great. So like I said, the key is just really practicing this when you're not panicking.